Welcome to our deep dive into iHuman Patients by Kaplan.
Sounds interesting.
We've got their website and a recent research study to kind of guide our discussion.
Okay.
For those of you listening who are interested in the future of healthcare education,
Right.
I think this is going to be a really fascinating tool to unpack and look at in more detail.
Yeah, iHuman Patients, it's really interesting how they're going beyond just like basic patient encounters, They're really focused on building those like diagnostic reasoning skills.
Yeah.
The things that healthcare professionals actually need to be successful.
Right.
So think about it. You're not just like clicking through multiple choice questions. You're like actually having to put together a diagnosis.
Right.
Like you're looking at a patient's history, their symptoms, what the lab results say, just like you would in a real clinical setting.
So it's almost like a flight simulator for doctors and nurses.
Exactly.
But instead of taking off and landing a plane, they're navigating the complexities of patient care.
Exactly.
And it's not just for medical students, right?
It's not. No.
I mean, they offer these cases for different healthcare disciplines, from nursing, physician assistants, even pre-med programs.
Yeah, all kinds of different levels.
And the platform is really accessible. It's on different devices, so students can practice anytime, anywhere.
Yeah, that flexibility is huge.
Yeah.
Especially these days.
Especially for busy students, right?
Yeah, exactly.
So we have a tool that's accessible, versatile, and it aims to develop clinical judgment.
Right.
But let's get into the specifics.
Okay.
What can you tell me about the cases themselves?
So they actually boast like hundreds of cases on this platform.
Wow.
And they're not just like random scenarios, they're really carefully designed to align with, the learning objectives and the competencies that the students need to learn.
So these cases have a purpose.
They do.
They're not just thrown in there.
Exactly, yeah. And for example, for nursing students, the cases are mapped to this next generation NCLEX decision-making model, which is a big deal for nursing education right now.
Right.
And this model really emphasizes critical thinking and clinical judgment.
Got it.
Moving away from just memorization.
Yeah,
so it's really about helping students develop, the thought processes of a skilled nurse.
That makes a lot of sense.
Yeah.
So it's not just about getting the right answer.
Right.
It's about understanding the why behind those decisions.
Exactly, yeah.
And what I find really interesting is that they've incorporated all these learning and assessment features right into the cases themselves.
Right.
Can you elaborate on that a little bit?
Yeah, so imagine this. You're working through a case and you order a certain lab test.
Okay.
And the system doesn't just tell you if you're right or wrong.
Right.
It actually gives you feedback.
Okay.
And it explains like why that test might be appropriate or not.
Good. Yeah.
Based on, what the patient's presenting with. And if you like miss a key finding or you make a decision that's not quite right, the system will offer you like remediation.
Okay.
So it's kind of guiding you towards a more accurate diagnosis.
Oh, that's interesting.
Yeah.
So it's almost like having a virtual mentor by your side.
Right.
Pointing out things that you might have missed.
Right.
And helping you to think through the case more critically.
Exactly.
Yeah.
It adapts to each student's level.
Wow.
So, they can configure these cases to give more or less support.
Okay.
And they can kind of gradually increase in complexity as the student progresses through the curriculum.
So they're not just thrown into the deep end?
No. It's very scaffolded.
It's scaffolded.
Yes.
Okay. And that's a great segue to my next question.
Okay.
So we know iHuman Patients is tracking every clicked in decision that a student makes.
Right.
But how does that data translate into actual learning?
Well, that's where the real magic happens.
Okay.
They've got these algorithms and they're analyzing student data and they can identify, individual strengths and weaknesses.
Yeah.
And then the faculty can use this information to provide targeted feedback.
Okay.
They can identify gaps in the curriculum.
Right.
And they can even pinpoint students who might be struggling before it's too late.
So it's like having a personalized learning dashboard for each student, allowing instructors to tailor their teaching and their support in ways that were never possible before.
Yeah, it's pretty amazing.
But are there tangible results to back up all these claims?
Yeah.
I mean, we need evidence that this approach is actually working.
Right. Well, that's where this research study comes in.
Okay.
And this wasn't just a small pilot study or anything.
Right.
They did this across 8 medical school campuses across the country.
Wow.
And the results were pretty remarkable. They found that students who use iHuman Patients showed, significant improvement in their diagnostic accuracy, their efficiency, and the completeness of their diagnoses.
Those are impressive findings.
Yeah.
So it sounds like iHuman Patients is actually living up to its promise of helping students develop stronger diagnostic reasoning skills.
I think so, yeah.
And it's not just this one study.
Right.
Right. We have additional resources by, leading medical professionals like Christopher Semino, David Schultz, who are also examining the effectiveness of virtual simulation for improving diagnostic reasoning.
Right.
And these experts believe that tools like iHuman Patients have the potential to truly revolutionize healthcare education.
Yeah, I think they're right.
It seems like this platform is really gaining traction and credibility within the medical community.
Definitely.
But speaking of credibility, let's talk about testimonials.
Okay.
I'm always curious to hear what actual users have to say about the platform.
Yeah, well, you're going to love this one. Dr. Vinay Kumar.
Okay.
He's a renowned pathologist at the University of Chicago. And he actually called iHuman Patients like the most exciting advance in healthcare education he's seen in his entire career.
Wow.
That's a pretty big statement coming from him.
That is a big statement.
Yeah, he believes it has the potential to not only transform how we teach, but also to significantly improve patient care down the line.
Wow, that's amazing.
Yeah.
And what about students?
Okay.
I mean, are they finding this to be helpful, or is it just like another assignment that they've got to complete?
Well, we have this great example. Nick Colazzo, he's a med student at Rutgers.
Okay.
And he really appreciates the feedback that the system provides. He feels like he's learning by making decisions and then getting corrected along the way, which is a lot more effective than just, passively absorbing information.
It's that active learning approach.
Exactly.
That seems to make the real difference.
Yeah.
But I'm curious, what about those rare cases that students might not encounter in a typical clinical rotation?
Right.
How does iHuman Patients address that?
Well, Nick actually mentioned that too.
Okay.
He said it exposes him to cases he might not otherwise see.
Oh, wow.
Which is really valuable for broadening his knowledge.
Yeah.
And it also, the platform itself has received support from organizations like the Reliance Foundation and the National Science Foundation.
Right.
So that speaks volumes about
about their impact.
Their potential, yeah.
That's a testament to the quality in the innovation behind this platform?
Yeah, I think so.
So we've covered a lot of ground.
Yeah.
Features, research, testimonials. It seems like iHuman Patients is a really sophisticated tool.
Right.
With a strong foundation.
Yeah.
But I'm also interested in the bigger picture.
Okay.
Where does this fit into the future of healthcare education?
Right.
And what does it mean for patients?
That's the key question, isn't it?
Yeah.
And that's what we'll be exploring in our next segment.
Great. I'm looking forward to that.
Yeah, me too.
So we've been talking about how iHuman Patients, really help students kind of sharpen their diagnostic skills in a safe environment.
Right.
But I think there's a bigger question here, isn't there?
Yeah, there is.
Can virtual patients really, truly prepare students for the realities of interacting with real people?
Right.
With all of their complexities and emotions?
That's the question.
Okay.
And I think it's important to acknowledge, no simulation,
Right.
no matter how good it is or how advanced it is,
Right.
can fully replicate, all the nuances of human interaction.
Right. You can't program a virtual patient to have a bad day.
Exactly.
Or to express anxieties in the same way that a real person might.
Right.
So where does that leave us then?
Well,
is virtual simulation just a stepping stone? A way to practice basic skills before they face the real world?
I think it's more than just a stepping stone.
Okay.
I see it as a way to help students build a strong foundation of knowledge and clinical reasoning skills, that they can then apply in real world settings.
Right.
So it's kind of like learning the rules of the road and practicing in a driving simulator before you get behind the wheel of a real car.
Okay.
You still need the real world experience,
right?
But that simulator kind of helps you get ready for it.
That analogy really clicks for me.
Good.
But I'm still wondering how iHuman Patients addresses the human element.
Okay.
I mean, they've put so much effort into, the technology and the algorithms, but how do they ensure that students are developing, empathy and communication skills alongside their diagnostic abilities?
That's a great point, and it's something they think about a lot.
Okay.
I think, one way they address that is just the cases themselves are designed to be realistic.
Okay.
It's not just a list of symptoms, They're interacting with these virtual patients that have backstories, they have families, they have concerns, just like real people.
So it's not just about, identifying the disease.
Right.
It's about understanding the patient as a whole person.
Exactly.
And I also like that the feedback mechanism in iHuman patients goes beyond simply saying, did you get the diagnosis right or wrong?
Right.
It actually assesses their communication style and how they're asking questions and, their sensitivity to the patient's emotional state.
So it's really looking at the whole picture.
It's really coaching them on how to be, a better communicator and a more empathetic clinician.
Exactly.
I like that. But isn't there a risk that, over-reliance on these virtual patients
Right.
could make students too reliant on data and algorithms?
That's a good point.
Right. Could it hinder their development of that clinical intuition that we hear experienced doctors talk about all the time?
It's possible, and that's why, we always say it's a tool. It's not a replacement for real-world experience.
Okay.
But think about it. A seasoned clinician.
Right.
They don't just rely on data, They use their experience, their intuition, and their judgment to make decisions.
Right. It's that gut feeling.
It is.
That you can't really teach.
Right.
It comes with experience.
Yeah. And these virtual patients, can help students develop those foundational skills.
Okay.
But it's really in those real clinical settings where they'll hone that intuition.
So it's about finding that right balance.
It is, yeah.
Using the virtual simulation to build a strong base and then layering on those real-world experiences to develop a more nuanced clinical judgment.
Yeah.
And as technology continues to evolve,
right.
We're seeing even more sophisticated ways to incorporate, the human element.
That's true.
Some platforms are even using AI to create these virtual patients who can respond to a student's emotions.
It's amazing.
And adapt their communication style accordingly.
It is. It really is.
That's incredible.
Yeah.
It sounds like science fiction, but it's happening right now.
It is.
But even with these advancements,
right.
I think we have to acknowledge there will always be limitations to what a simulation can do. So how do we ensure that students are getting, the full spectrum of experiences?
Right.
They need to become well-rounded healthcare professionals.
I think it's about integrating virtual simulation into a broader curriculum that includes, real-world clinical rotations, mentorship from experienced clinicians, opportunities for reflection and feedback.
I like that.
It's about using, simulation to its fullest potential to really maximize the value of those real-world experiences, not to replace them entirely.
It sounds like a really powerful combination.
I think that is.
Leveraging the strengths of both, the virtual and the real world.
Absolutely.
But let's shift gears for a moment.
Okay.
We've been talking a lot about the student experience.
Right.
But how is iHuman patients impacting healthcare education on a broader level?
Well, I think one of the most significant impacts is in the area of accessibility.
Okay.
Traditional clinical rotations can be hard to come by, especially for students in rural areas or, students that have limited resources. Virtual simulation can really help level the playing field there.
That's interesting.
Yeah, it can give them access to those high-quality experiences, no matter where they are.
That's a huge advantage.
Yeah, it is.
Especially as we're facing, a growing shortage of healthcare professionals, particularly in those underserved areas.
Exactly.
But what about the cost?
Okay.
Developing and implementing these programs can't be cheap.
No, it's definitely a factor.
Is it only accessible then to, elite institutions with deep pockets?
Well, cost is always a concern. But the landscape is changing.
Okay.
As technology gets better, the costs are coming down.
Okay. That makes sense.
Yeah, so it's becoming more accessible.
Okay.
And, some organizations are even thinking about how to use virtual simulation to address the faculty shortage.
That's interesting.
Yeah.
How would that work?
Well, imagine using virtual patients to, deliver those standardized lectures.
Okay.
Or to provide, personalized feedback to students.
Got it.
And then that frees up faculty time for more of that hands-on instruction.
Right, or that one-on-one mentorship.
Exactly. It's not about replacing educators.
Right.
It's about, really maximizing their reach.
Okay.
And making sure that, all students are getting a consistent level of education.
It's like having a virtual teaching assistant.
Right.
Who can help manage those more routine tasks. And then the faculty can really focus on the parts of teaching that require their expertise.
Exactly. And by standardizing, certain parts of the curriculum through simulation, you can help ensure that all students are graduating with those core competencies.
That makes sense.
Yeah.
No matter where they trained.
Exactly.
Which is really important.
It is.
Especially as healthcare professionals are so mobile these days. It really helps ensure that patients are receiving that quality care no matter where they go.
Yeah, consistency is key.
Yeah. But with all this talk about standardization in technology, I'm wondering if we're risking losing something in the process.
Okay.
Could there be a downside to having healthcare education become, too uniform, too focused on algorithms and data points?
That's a good question. Healthcare is both a science and an art.
Right.
And while data and technology are essential, they should never replace the human touch, the compassion, the intuition that are really at the heart of good care.
Right. And that's something you can't capture in a simulation.
No
matter how sophisticated it is.
Right.
There's a certain intuition, a gut feeling that experienced clinicians develop over time. That's really hard to quantify or to replicate.
It is.
And that often comes from years of interacting with real patients.
Yeah.
Observing those nonverbal cues and really learning to read between the lines.
Exactly.
It's about recognizing that each patient is unique and that their symptoms might not always fit neatly into a textbook definition.
That's true.
So how do we make sure then that future healthcare professionals trained in this data-rich environment don't lose sight of that human element?
Well, I think it starts with education.
Okay.
Medical and nursing schools need to go beyond just teaching students how to use technology and how to interpret data. They need to really emphasize the importance of communication, active listening, building rapport with patients.
So it's about striking that balance.
It is. Equipping students with those tools, the powerful tools of data analysis and technology, but never letting them lose sight of the fact that healthcare is about human connection.
And compassion.
And compassion, exactly.
It's a tall order.
It is.
But I think it's essential if we want to create a healthcare system that is both technologically advanced and deeply human. And it's a conversation that needs to continue as virtual simulation, becomes more and more integrated.
It does,
into healthcare education.
Absolutely.
We need to be mindful of both the promises and those potential pitfalls. And work together to make sure that technology is enhancing, not diminishing the human experience of healthcare.
Couldn't have said it better myself.
Well said. And that leads us into our final segment.
Okay.
Where we're going to kind of explore this idea even further.
That sounds good.
So we've talked about the features of iHuman patients. And, kind of the impact of virtual simulation on healthcare education in general. But there's one more layer I want to kind of peel back here.
Okay.
We focused a lot on how this technology is changing how healthcare professionals are learning. But I'm kind of curious about the ripple effect.
Okay.
Could it change how healthcare itself is delivered?
Oh, that's a good question.
And think about it. Imagine a future where doctors and nurses have had all this training on these incredibly detailed simulations. Could it lead to a healthcare system that's even more data-driven? Where algorithms play a bigger role in diagnosis and treatment decisions.
I think that's definitely a possibility.
Especially when you think about the sheer volume of data that these students are exposed to in iHuman patients.
They're analyzing lab results and patient histories, imaging studies, and they're getting real-time feedback on those decisions.
It's almost like they're being conditioned to think like medical detectives.
It is,
like piecing together all these clues to solve these complex cases.
And, that analytical approach can be so valuable.
Especially for rare or complex conditions.
Exactly.
But, I wonder if there's a potential downside here.
Okay.
Could it lead to a healthcare system that's maybe overly reliant on data, where that human touch in medicine kind of gets lost in the process?
That's a good point. I mean, healthcare is so much more than just, crunching numbers and applying algorithms.
It's about understanding the patient's story, their fears, their hopes.
Exactly.
And tailoring those treatment plans to their individual needs and values.
And that's something you just can't capture fully in a simulation.
No matter how good it is.
Exactly. There's a certain intuition, a gut feeling.
That experience that you were talking about.
That experience that clinicians develop over time.
And it's hard to quantify that.
You can't.
You can't teach it. You can't really replicate it. And that comes from years of interacting with real people, observing those nonverbal cues, learning to read between the lines.
Exactly.
Recognizing that each patient is unique and their symptoms might not always fit neatly into a textbook definition.
And how do we make sure then that these future healthcare professionals who are being trained in this data-rich environment don't lose sight of that.
Of that human element.
That human element.
Yeah.
I think it starts with education.
Okay.
Med schools, nursing schools, they need to go beyond just teaching, how to use technology and how to interpret data.
Right.
They need to emphasize communication, active listening, building a rapport with patients.
So it's about striking a balance then.
It is.
Right? Equipping students with these powerful tools.
Yeah, data analysis technology.
But reminding them that at the end of the day, healthcare is about human connection.
It is.
And compassion.
Absolutely.
And that's not just about the curriculum.
No.
It's about fostering a culture
right.
of empathy and human-centered care within healthcare institutions.
Yes. Creating environments where clinicians feel supported and taking the time to listen to their patients, to really understand their circumstances and make decisions that are both, evidence-based and compassionate.
It's a tall order.
It is.
It's essential.
It is.
If we want to create a healthcare system that's both technologically advanced and deeply human.
I agree. And it's a conversation that we need to keep having.
We do.
As you know, virtual simulation becomes more integrated into healthcare education.
Absolutely.
Yeah.
So as we wrap up our deep dive into iHuman patients today, we leave you with this final thought. Technology is transforming healthcare education.
Right.
In some really profound ways.
Yeah.
And while it holds so much promise for improving patient care, we have to use it wisely.
Yes.
Ethically, and always with the patient's well-being at the forefront of our minds.
Couldn't agree more. Thanks for having me.
It was a pleasure having you. Thanks for joining us on this deep dive into the evolving landscape of healthcare education.
My pleasure.
We encourage you to continue questioning, exploring, and engaging in these important conversations about the future of healthcare.